Professor Bismuth and Professor Uriel, ladies and gentlemen, today I feel very honored to share with you the new project for an old idea, the work system. I am a surgeon, but this is not an invasive device. Work system is a digitally controlled electromechanic and pneumatic device for all those who need to reproduce the vascular effects of walking when they are unable to do so. As commonly accepted by the scientific community, the concept of muscular pump includes several simultaneous local and central circulatory effects that are stopped when our legs can be in exercise. There is a large body of evidence in medical literature which demonstrate that ambulation improves circulation, prevents VTE and promotes wound healings, removing interstitial fluid and allowing tissue decompression. In more than 15 years, I studied an algorithm and a device with a self-learning digital system capable of encoding the way a patient's work into electrical waves and reproducing in real time the pressures and cycles a human gained, in order to reproduce with high fidelity the vascular effect of ambulation. The work system algorithm solves many problems regarding different static conditions involved in hemodynamic and standing, sitting or lying, and anthropometric data. I began this study in 1994 in University of Ferrara, Italy. In the table, I want to represent conservative estimates of the US market size of the patient's population suffering from conditions that are cause of chronic or temporary immobilization like muscular disease or like vascular disease or surgery. About 100 million of people, 1 in 3 people in USA would benefit from work system. In world, 34% of women, 29% of men have a physically inactive lifestyle. Data from World Health Organization show that insufficient physical activity is one of the 10 leading risk factors of global mortality. Insufficient physical activity is estimated in 23% of adult age 18 plus, men 20%, women 27%, and in 55% of the adult age 55 plus. Insufficient physical activity increases risk of cardiovascular mortality by 20% to 30% due to ischemic heart disease, diabetes, stroke, hypertension, clinical limb ischemia, amputation, DVT, pulmonary embolism, increased disability, adjust life years. People that could benefit of work system are first, people suffering of temporary immobilization in an intensive care bed or an operatory bed, an hospitalization bed, or sitting for long distance travel, whether by car, bus, train, or plane, during pregnancy, or as a consequence of bone fractures or recent surgery or trauma, or during a rehabilitation period. Then people suffering from chronic immobilization due to venous or arterial insufficiency, lymphedema, diabetic foot, leg venous vascular ulcers, cancers, obesity, age, musculoskeletal disease, neurological disease as stroke, Parkinson, multiple sclerosis, neuropathy. Then medical doctor or technicians who use ultrasound Dopplers and company producing vascular ultrasound devices. In fact, the standard limitation of duplex ultrasound in quantification and standardization of venous flow is the impossibility to study the subject during walking. With work system device integrated with ultrasound, we can do this, and that at least work system could help all people with sedentary lifestyle, 30%, 34% of women in the world, and 29% of men. The new work system project I present to you is a high-tech innovative solution for the real-time reproduction of pressures cycles of human gait through actuators that fits over the extremities and applies a beneficial compression and reproduce the hemodynamic conditions of walking. The work system will be constituted by two flexible stocking-like garments, two actuators for feet and calves, pneumatic and electromechanic integrated, one power control system situated in a belt. The flexible stocking-like garment is composed of a urethane or silicone-like material shaped as a stock. This material have properties which facilitate the evaporation of moisture and reproduce shear forces to the skin tissue. This stocking will have to be worn on the intended limb before using the device. The pneumatic part of the device has two functions: self-learning of pressure cycles waves when possible, and required pre-filling of system 30-40 millimeters of mercury for a comfortable fit and pressure feedback with the electromechanical part of the device. The electromechanical part positioned over the pneumatic one is a band tensioned by a miniaturized brushless DC electric motor that reproduces the pressure waves that are acquired and or elaborated. The two systems give continuous feedback to each other, never before envisioned by any prior art. The novel combination of these two standards could provide the most advanced option to reproduce vascular effect of walking, and for this the best option to prevent vascular disability due to secondary lifestyle or temporary chronic immobilization, and in diagnostic situation with ultrasound and Doppler. This device, in association with duplex ultrasound, in fact, could be the gold standard in the diagnosis of venous disease in order to compare effects of pharmacological treatment, surgery, and rehabilitation in restoring vascular flow in an orthodynamic way. The work system will be equipped with a small battery-powered control system situated in a wearable belt. This cordless belt will ensure controlled maintenance of a pressure cycle to the entire limb as needed. Ambulation can be seen from two points of view: biomechanic and vascular. The cardiovascular effect of muscular pump are due to venous blood eject during ambulation. The muscular pump is the peripheral heart that is active only during walking. The venous vessels are intimately connected with muscles. This fact allows to mechanical forces produce venous blood ejection. This is a central point in vascular medicine. The muscular venous pump during muscular ambulation increases left ventricular filling pressure, hepatic flux directly available to the working muscles. Cardiac filling pressure increase about 3 times the amount of oxygen in capillaries system, and can increase muscle blood flow rate up to 80% with muscular capillarities vasodilation. We know through experimental study the pressure wave of blood flow during ambulation measured with the in-vena pressure transducer in superficial and deep venous system. The graph shows that in our venous system, when we are resting and standing, we have a pre-filling pressure of 50 millimeters of mercury. While working, we produce two positive waves due to foot and calf activation, and one negative in which the blood from the superficial venous system is sucked into the deep venous system. We want to reproduce this, not simply a blood movement, like generally. Cycles of work are generally 300 milliseconds and pressure of 150 plus millimeter of mercury if measured in normal walking at 3 kilometers per hour. But this is only one aspect of walking. The so-called natural work is a rhythmic movement performed with the following cycle. Lift one leg off of the ground, using the leg in contact with the ground. Push your body forward. Swing your lifted leg forward until it's in front of your body. Fall forward to allow your lifted leg make contact with the ground. Over the past few decades, multiple advances in bioengineering technology have permitted precise analysis of many specific gait biomechanic characteristics such as joint angles, angular velocity, and angular acceleration kinematic analysis, as well as ground reaction force, joint forces, moments, and powers kinetics analysis, electromechanic activity, and energy consumption. But regarding vascular modification in flows, venous flows while walking, we are scientifically bound to invasive phlebodynamic evaluation performed by Rorty in the 60s, as shown before, and the study generally of Rechek in the last decades. That simulation of walking vascular effect of ambulation has always been the goal for many researchers because of extreme personalization of walking depending from one cycles to gravity, standing, sitting, or lying, and anthropometric data. They mainly concentrated on the effect of electric or pneumatic stimulation. The difficulty in comprehending the venous hemodynamics and muscular perfusion during walking is certainly caused by the great discrepancy between the two experimental simulations. The isometric contraption induced by the electrical simulation traps in the blood into the muscle instead of ejecting it, just 2 millimeter kilo versus 23 millimeter kilo in voluntary. Because of this, in our experience in these 15 years, you can see in 1994, we realized an only pneumatic device with a software package that processed data coming from pressure transducer. We described an apparatus which gives a quick and detailed picture of the distribution of the pressure under the foot and behind the calf. This can be displayed either as a continuous grayscale of a color contour map on a PC monitor. The automatic analysis system allows us to measure pressure and loads and their distribution under the foot, behind calf, while standing and walking, employing a dedicated software. The dynamic system has been clinically employed to reproduce the vascular effect of walking with an echo-color Doppler feedback and give us the change to obtain an algorithm which is close loop summarizing the main feature of the gate, but self-learning digital pneumatic systems have limitation we solved with the new one I present you before. This definitive work system have no competitors. Competitor for the new work system can be divided in two categories: intermittent pneumatic compression device and electric muscular stimulation device. Existing intermittent pneumatic compression device provides external compression without any self-learning system, any feedback control of the vascular effect of gait cycles. They all share a number of significant technological limitations due to motorized pump control that cannot reproduce cycles of 30 and 300 millimeter of millisecond and pressure of 150 plus millimeter of mercury. IPC devices repeat static cycle which with low pressures. Otherwise, they are limited by frequent need for custom fitting to assure an appropriate use. Patient compliance with recommended use of IPC is notoriously low, even in hospital setting with constant observation. These devices are generally and widely requiring a pump that plugs into a battery or other power source. Moreover, the need for a pump limits the portability of this device. Moreover, the isometric muscular contraction induced by electrical stimulation device traps the blood into the muscles instead of ejecting it, just 2 millimeter kilos versus 23 millimeter kilo in experimental studies. This is the why we can exclude electric muscular contraction device produced by our competitors. Capitalizing on the limitation of existing technology, the work system will allow for easy, cost-effective prevention, treatment, and diagnosis for many cardiovascular conditions. The new work system I propose you is intended to be developed in 3 different devices in function to complexity and target. Work system professional with complete algorithm for self-learning application, diagnosis, research, and with echo-color Doppler and other procedure and therapy, and with wireless belt control. The work system hospital with or without self-learning application, the work system home only with personalized working application inside. Work system will be sold to medical doctors, technicians, health institutions, and featured directly to the customers. The market category where we can introduce work system are vascular and ultrasound market, hospital bed market, compression devices market, rehabilitation market, home health market. It might even be possible to rent the device. Projection for work system hospital market penetration in USA, if we think at only 1% by year 3, is 1 million of people. We heavily invested in work system prior to any external funding, and we developed an innovative algorithm during the last 15 years. Currently, we are looking for rise up of 100,000 in seed capital, which will advance the work system technology up to commercial launch of the product. Then we mean to take the work system to market at select institutions beginning year 1 and 2. Good manufacturing practice. We have the first year. Here we have the first year startup. Work system will initially consist of manufactured goods The strategic operational plan is to minimize overhead through the outsourcing of production and warehousing for the well system. We will also decrease the required startup capital through the rental or leasing of necessary equipment whenever possible. It's evident that I search for industrial partner for investment and development in material technologies and interface design. Our time to market advantage is the innovative idea, the extensive market and technology, and overall working closely with physician to design the product. The importance of working with physician is in developing novel therapy is well known. Through leader in the areas of surgery, rehabilitation, and angiology, diagnosis overall can provide input on elements of the device and planning coordination future clinical trials. We mean to organize clinical study with a leading expert in the field of cardiovascular prevention, diagnosis, lower extremity disease, treatment, and eventually at major treatment center. This will be invaluable in the promotion of the work system as a viable medical therapy. Thank you in advance for your interest.